Hello, hello, my people. Okay, I think we're good here. Okay, here you go, guys. Welcome to another office hour session. And where today will be sharing more clinical pearls and just things that I've been seeing in real life in the clinic, and just try to catch you guys up and speed your learning curve up. Maybe teach you a little something about maybe some things you've seen or heard about, or maybe never ever heard of. Most of the stuff, again, it's everything you need to know, but nobody's telling you. Actually, a topic I wanted to talk about today is really important, and I think the bigger topic is really the main topic is healing the mind. I mean, this is the medicine, really. This is the main medicine that let's get you guys up just a little bit. All right, that's better. The main medicine really is healing the mind. I mean, I think this is most important. This something that's really, really, really clinically important. There's a saying that we have in the naturopathic world. There are no incurable diseases, only incurable personalities. Or another way to say that is there are no incurable diseases or conditions or situations, but there are incurable minds. So the first step, always really the prerequisite step, is to be able to heal the mind, and we got to find some way to do that. So there's a lot of ways you can do that, and many, many, many things I've tried over the years and done over the years. One of the things that I do a lot of, and that I work a lot with, and I think there's some element of it with just about everybody, is some kind of mental karma or mental obstacles or mind obstacles. And for everybody has their own flavor of it. Everybody has their own everybody has their own susceptibility, their own mental, their emotional susceptibilities and tendencies, and the different mindsets that you go into when life challenges you, and when you may be doing all good, and if everything's all good, but then life hits, some stress hits, and unless your nervous system has trained and practiced and is ready to digest that stress, it will rattle the system, and immediately you'll go back into default patterns. Means what are your programmed responses? What habituated ways do you go into responding to something? Some of us get upset and we cry at everything if we get overwhelmed. Some of us get irritable or frustrated or grumpy, or some other flavor of that. Some people kind of laugh it off and maybe don't take what's happening seriously and try to move through it. And there's nothing wrong with any of these, but we do need to keep ourselves, we do need to recognize that we have our patterns that we need to heal. And this is especially, I think that, some people have more heavy karmas with body stuff, with body patterns, and with, maybe healing the body, and different challenges like that. Other people have, more karmas or more susceptibility with mental, with mind, with emotional kind of imbalances or disturbances. People may really struggle with depression or anxiety or OCD, or or something more dramatic like the dissociative states, or or schizoaffective or schizophrenic type states. I mean, this stuff is like probably more common than you think. Like, it's okay. Got a minor connectivity issue there. Okay, sorry about that, guys. Okay, so anyway, the main thing is we're talking about healing the mind. I mean, and this plays in the role, if it is in the mental sphere and that's what you're dealing with, then okay, let's dig in, look for the breakthrough, find the breakthrough. This is what I've used homeopathic medicines for years. I still think that long term, and some of you guys know that are in this room. I don't know, if you're tuning in right now, but I know some of you are in this room that we've treated, that are in our community, that we've worked on these different things, and we've seen what 2, 3, 4, 5 years of homeopathic treatment can do for the mind. Sometimes, it sometimes in the moment it feels like it's slow motion, but again, you get 3 months, 6 months, 1 year, 2 year, 3 years, 5 years down the road, and you start looking back, and that's where you can really see the transformations homeopathically. But one thing, sometimes you just need something to shake your world up. I think every once in a while, every once in a while, I think there are certain times and phases that people go through in their lives where you really have to, and this is really healthy to do, every day, really, once a year, is to take an inventory on just take an inventory on your life. There are various exercises and things that you can do to do this, but the simple kind of boiled down version of it is just, at the end of the day, sit in meditation just for a few minutes, even 3 to 5 minutes like this, and scan back through your day and kind of relive and complete through the day, and make sure that you're not carrying any kind of hangover from the day or the previous day. Make sure there's no hangover or residue or any kind of conflict that you're carrying into the next day. Do the best that you can to try to complete that. But life is crazy, man. Life is crazy, and life is full of suffering, and that's just the reality of it. If you spend enough time on the planet, you will see that life will challenge you. I mean, and this is not a good or a bad thing. It just is a thing, and this is just one of those things, guys. It's like, welcome to Earth. What happens is happening, and it's our responsibility to find a way to digest that life that has happened to us, to assimilate that, to incorporate that, and then to move forward in a way that's above the line and really be a complete human being, and do our best to be a complete human being. Now, am I claiming that that's what am a complete and totally above the line all the time? No way. But that's partly what I'm doing here, is sharing those experiences personally and clinically, and and just sharing those things together. So that's a little bit of the foundation, just about why is the mental part of this important. And if there are physical symptoms now, if there are physical symptoms manifest, the mind can start to become affected. For example, pain. Just take a simple example like, a headache, or a sudden onset of a joint pain, or something that is different, that really, really, it really challenges you. It calls to your attention, and that can over time kind of mess with your mind a little bit and leave you, especially if you're trying things or you're doing different things and it's not giving you the results and it's not resolving. We got to look into and make sure we keep our mind strong, and make sure we keep the mind strong, and then make sure that we can keep the mind in a positive state. And at least when things happen, it's not saying that the mind stays in a totally positive state all the time, 100% of the time. That's not, I don't really know anybody that can do that. I mean, there may be enlightened saints, sages, beings that reside in that space, but I'm talking about regular, real life people that are like in the world with jobs and colleagues and coworkers and spouses and children, and they get behind the snowbirds in traffic and they get cut off, and all this other kind of stuff that happens to people, and the little things that you have to go through day to day, versus just high up in the Himalayas, in the cave, meditating, deep in the jungle, far away from society. Okay, that's a different trip. That's a different trip. I'm talking about for the people that are in the world and living in the world, which to me that is the main thing that we're doing here is ironing out our mental processes so that we can create health in our thoughts and in our speech, and ultimately in our bodies. We can create that health, and we can do that. And so that's a little bit of kind of setting the stage for, why is a breakthrough in the mind, why is healing the mind important? Well, because we need the breakthrough. We need to be able to have a peace and equanimity in our mind, and we need to have a health and a vibrancy in our body. And one of the tools that we can use to do that is the tool of psilocybin. And this is a big tool, that is really, it has a lot of, I think there's still a lot of the reefer madness kind of stigma around psilocybin. That's starting to fall, as it is with other cannabis type medications, and using cannabis as a therapeutic, which also has a time and a place and a proper application for the proper person. It's not the best thing for everybody. But psilocybin as a medicine is, this is one of these things. The plant medicines have been used for who knows how long, really, in the earth-based and in the jungle medicines and in the shamanic traditions, and in these places where this is utilized as a ceremonial medicine and as a kind of a rite of passage. Those are that's a part of our culture that I think has been lost, and I think that is that's a greater issue, is the issues of initiations and rites of passage for for young people moving through the different stages of our lives, which we definitely have different stages of our lives. We move through adolescence, and we go through that initial 7-year cycle, and there are major transitions every 7 years in our psychology and in the energetic makeup. And so it's good to know how to utilize some of these medicines to get a little bit of distance, but because the more time that goes by, we get more and more attached to our personalities. We get more and more attached to our personalities and being right about things and what we know to be true. And we get, I think that's just part of psychology, and part of that is good, to repeat something, and through the repetition we learn things, and certain things go on complete autopilot, like driving down the road and things like that, or riding a bike or whatever. You can do those things, and they're just there, and there is a remembered kind of way of doing that. But so our responses, and the way that we interact and the way that we behave with the world is really important. And that's really, sometimes you need the breakthrough in the cognition or in the internal paradigm and the thought processes that you're having. Sometimes we need to put a little bit of distance between that personality, and we need to just get a little bit of a gap there, so that we can see our own stuff, so that we can see what's going on, and we can, so that we can understand that and dissect that, and so that we can just be, so that we can heal, so that we can be complete human beings. This is a big deal. So psilocybin is one of the ways we can do this, and what I specifically wanted to I kind of want to introduce this idea today. And some of you guys might have heard of this, some of you guys might have not heard of this. I just want to put the seed out there, and then I think to follow up on this, and let you guys kind of think about this, and some of you that are maybe tuning in and that are practicing with this particular method, if you want to weigh in at all, or if anybody has any experience with this, I think to put this into the conversation, because there's a right way to apply the therapy, and there's not a wrong way, but not the best way to apply the therapy. And so what I'm talking about is microdosing psilocybin, which is to say microdosing, taking minute doses of magic mushrooms to get a breakthrough in your mental setup so you can heal your mind and have a peaceful, calm mind, or at least know how to access that state. And then if you need a breakthrough, if you are having issues maybe with a physical issue many times, if we can get a cognition shift, a cognitive shift, a shift in the mental patterning, a shift in the neurological patterning of the individual, oftentimes that will open up and kind of create that little gap there so that the person can see, so that we can see our own shit, so that we can see our own stuff, so we can see our own patterns and see, is there something here is there some obstacle here that is in the way? Is there some new vantage point or some new perspective or some other way that we can look at something therapeutically and get a greater healing? And microdosing psilocybin, I have found to be a wonderful way to do that. I have had experience with this. In an exposure way. I mean, I've been knowledgeable of this world for long time now, probably 25 plus years, and so I've kind of followed this science over the last you know 10, 15, 20 years, and really, and we do have some colleagues that are actually really into this work and doing the, more of the research work with Esalen and, in some of the institutes in Santa Cruz and some of the research entities that are trying to and actually are making some headway in the mainstream psychological professional world and also the psychiatric community, because there are many individuals that are either resistant to pharmacological interventions, the SSRIs and all of the meds that they use for depression. A lot of them don't work for people. And the reality of it is none of them work, and that's the real truth. And that's why I'm not a big fan of trying to double-blind placebo control these studies. I think that you just cannot do that with individuals, and I know everybody wants evidence-based and science-based and proof and reality, but okay, it just doesn't work like that because individuals are different. They have different life experiences. People have different traumas. They have different dramas. They have different experiences. They have different psychologies that are unique. And no matter what anybody does, you're not going to be able to cookie cutter trial it and have that kind of evidence-based like they kind of try to do. That's why I think whole evidence-based thing is just difficult in the world of natural medicine, because the evidence-based world does not account for personalization and biochemical individuality and unique expressions of things. So that side of the world is a different world, but nonetheless people are trying to do it, and they're actually successfully do it because you can fudge numbers and then present data and get present the picture out there, which is great, and get positive results. And it actually is showing positive results with especially with traumas, PTSD type traumas. And this has I think many people have experienced a trauma, and then they kind of will relive that trauma and have the qualifications for something that would be PTSD or post-traumatic stress syndrome. In their world, there are people that are dealing with many flavors of anxiety, generalized anxiety, and all the different variations of that. I'm not a fan of the DSM criteria and the DSM labeling. It's helpful just to know about that stuff and to help understand a person's experience, but I don't like to give labels to people. So that's partly why I don't, I'm not a fan of the psychiatric community. But this is definitely where the natural world and now a lot of the mainstream world is nothing new really there either. They're trying to borrow the things that actually are effective from the natural plant world and then bring that into the mainstream world, which that part of it is really great. Quantifying it makes it a little difficult, but real life experience, guys, is really the best thing. So micro dosing psilocybin, I'm talking about using this to heal the mind and healing the mind and healing the body. And we're talking about non psychedelic doses of psilocybin. And so historically, that means under 1 gram, means under 1,000 milligrams is what we're talking about. That would be, and you may see, if you look on the internet, you'll see slightly different variations of this range, but let me just kind of go through what is considered a micro dose and what is considered a macro dose, just to kind of lay the groundwork out. A micro dose is considered under 1 gram, which is 1,000 milligrams or less. Okay, and then the realm of between 1 gram and 3 grams, you will start to get perceptual visual changes, and you will start to get some lower dose, and it's depending on the strain and the type and the sourcing and all that stuff. But between 1 and 3 grams, you will start to get those low dose psychedelic effects. Most commonly, there's a kind of a euphoria that comes along with that and mild visual changes. Above that, now 3 grams up to 5 grams, that's going to be a psychedelic dose. That's where we're talking about a ceremonial dose, and that's where you want to have a guide, a Sherpa, a shaman, a friend, an ally, somebody to hold the space for you, somebody to actually to create that container for that ceremony there, so that you can actually journey and do some deeper journeying. That's a little bit of a different topic. I think we should unpack that maybe another day. We just want to introduce this. And then when we approach 5 grams and above, this is the hero's dose. Will definitely be psychedelic, will definitely have visual changes and euphoria, maybe physical sensations. Some people do report GI symptoms. Those can be avoided by keeping an empty stomach going into a heavier medicine dose. Again, you're definitely in ceremonial breakthrough territory there, where unless you're experienced with the medicine, I would really recommend that you have somebody that has traversed that territory before, and somebody again that can set up that space and create a ceremonial container for you to really have a giant breakthrough. And that's a whole tremendous area, and this is something that a lot of people are doing out there these days, and I think it's really important. And this is one of those things, that a situation like that, just by the way, that's not a daily thing. This is something that you may need. This may be a few times in a lifetime that you need that kind of a dose, okay, really to get a breakthrough. And then again, with just like any other medicine, plant medicine, we want to be respectful of it, whether it's psilocybin, whether it's cannabis, whether it's homeopathics, whether it's just other more routine daily use Western or Ayurvedic or tonic herbs. We want to be respectful of the medicine and know when to use it. If we're using really potent medicines, really strong medicines, use the medicine for the strong dose and assimilate that, incorporate that in. We don't want to get into that thing where we're using heavy high dose medicines as a means of escape. That's something different, and that's a different conversation, but that's just can be, depending on people's personality, a slippery slope there. So respect the medicine, use the psilocybin and these stronger medicines, these plant medicines. These have been used for ages, and there is a right way to create the container. And now what I'm talking about now are the micro doses under 1 gram. And I think even depending, and this is something that can be customized, I think even starting out as low as, I think a true microdose is in the range of 50 to 100 milligrams. And what we say do, let me just kind of lay out what one example of a regimen might be, and then we can kind of talk about it a little bit more. So when you're microdosing, you're basically not going to be altered or affected or intoxicated in any way. You should be able to perform all your daily duties as as they are intended. That being said, depending on where your occupation is or what you're doing or how you're serving people or how you're working or what you're doing, you can make your own schedule up. So one sample schedule that people would do for microdosing is like 4 days on and 3 days off, or 3 days on and 4 days off, or 5 days on and 2 days off, like this. And so you would take the medicine, say for example 50 milligrams, and we'll say 4 days on and 3 days off. So we would do 50 milligrams. And by the way, the issue of sourcing the medicine and purity and potency and quality, that's a different conversation. Let's talk about that. And if anybody is really interested in that, if you are actively a private patient, let's talk about it and come up with a plan and a strategy and a dose and a scheduling that will work for you in your life. And if you're not an active patient, message me and we'll talk about that. But let's just talk about the dosing and kind of get some of the numbers straight in our mind and some of the dosing straight in our mind, just again, so we can just kind of open up this thing and then talk about it some more. So sample microdosing would be, say, 50 milligrams for doing 4 days on and 3 days off. So in the morning of, you would do your 50 milligrams, normally in a capsule format. Say capsule format, 7 a.m., day 1, 2, 3, 4, like this. Generally just the once a day. And see, you don't have to do anything or anything special at all. I think it is helpful to keep a little bit of a journal or take some notes along the way, on really all the days, but you don't have to. 4 days on, 3 days off, and then you just work on yourself. You work on yourself and you pay attention. And I think it is helpful to have some kind of a meditation or mindfulness practice when you're doing this, because that is going to help you see things a little better and see things a little more clearly, so you can see your own stuff and pay attention as you're going through your day. And as normal things are happening, there's something that happens, when this quality of being able to watch ourselves and developing that quality of the watcher, of the observer, of the witness, of the higher self, watching this other self, personality self, go through the world. Watch that self, and something happens with the microdosing. Then this is what people have reported. Over time, there's some kind of little shift that happens. It's as if the medicine is putting a little gap there between us and our personality. Maybe things that we're trying to do, little ways that we're trying to improve ourselves, being that 1% better each day, being that, just looking and not comparing to who anyone else is today or any other time, but only looking at ourselves as we are right now and in the recent times, and then working with that, accepting that, and moving on and healing that. And again, finding those little micro breakthroughs each and every day. That's really the long-term medicine here. And honestly, that's the most important thing to me. Now, some people may or may not care about that. They may just want their symptoms to go away, and that's all good. But part of what I'm talking about is working at the deeper levels and using plant medicines to do this. Homeopathy works tremendously well alongside this, and we're playing the long game with healing the mind and healing the mind so that we can more in a deeper way heal our bodies, and in a deeper way create health and create and cultivate this vitality. That's really what we're talking about. That's what we're really talking about doing, is using the microdosing to heal the mind and to have these breakthroughs like this. So you guys let me know what you think. Has anybody out there tried this? Any of you guys that we're working together, are you guys tuning in and watching this? Do you have anything to add? Have anybody have any questions about this? Let's open up this topic. I think it's a really interesting topic. And I think it's a really powerful topic done the right way, in the right proper context. And we can create tremendous breakthrough in the mind and create the tremendous breakthroughs in the body. And we can use plant medicines to do that. These are non-traditional plant medicines. Well, actually, there's nothing more traditional than this, but you understand what I'm saying. This isn't the stuff we grew up hearing about, is what I'm talking about. And there's tremendous ways we can heal the mind. Psilocybin is a super powerful tool. And I think we're gonna continue this conversation in some other ways. And depending on what kind of feedback I get, what kind of questions I get, we'll pick it up from there. So you guys let me know your thoughts. Super interesting topic, super powerful topic. Okay, that's our office hour sessions today. Adios, people.